Breathing is a physiological process that involves the oxygenation of tissue and the removal carboxygen received from the body. Breathing is maintained by external respiratory systems, cardiovascular system, and blood. It's all systems include for process of breathing or not? What is your opinion? Where nervous system for innervation, this is organs, yeah. Where not only blood, where lymph, where other system, and you remember very important in the intersystemic connection. Okay, and changing its oxygenated blood and deoxygenated blood, and connection between and from capillary is very important in the internal respiration, and external respiration. It's other moment in the breathing. External respiration, a set of processes that occurs in the lungs and provide a normal gas composition of the blood in accordance with the needs of the body. The external respiratory system consists of respiratory tract, pleural cavity, lungs, chest with respiratory muscles, gas. Homeostasis is supported by the following process. And lung ventilation, diffusion of gases through the alveolar capillary membrane, airborne barrier, blood flow in the lungs, perfusion, and regulatory mechanisms. And how many cycle you remember in a cardiovascular system, for example? Main, it's a pulmonary cycle, circulatory, yes, and systemic. But very important, for example, for association with cardiac circulation, it's a circulation of the lungs. And in the lungs must be present vascularization, not only for in the alveoli, for function of the lungs too. External respiration is a set of processes that take place in the lungs and ensures of a normal gas composition of the blood, adequate to the needs of the body. The external breathing system consists of respiratory tract, pleural cavity, lungs, and chest with respiratory muscle. Blood gas homeostasis is supported by the following process: lungs ventilation and diffusion of gases through the alveolar capillary membrane, aerohemic barrier, blood flow in the lungs, it's a perfusion, and regulatory mechanisms. Respiratory failure is a pathological condition in which the external respiratory system cannot supply sufficient oxygen to maintain the normal gas composition of the blood. Classification of the respiratory failure is according to the cause. It's acute, subacute, and chronic. Acute develops in minutes, hours. For example, it's asphyxia. Subacute, days and weeks, during days and weeks, and chronic, months, years, is a consequence of diseases of the bronchi and lungs. According to severity, it's a mild, moderate, and severe. And it's a portion of oxygen, for example. According to severity of clinical signs, it's a compensated and uncompensated. Next, according to the pathogenesis, ventilation respiratory failure is divided into deregulatory, restrictive, obstructive, and parenchymal respiratory failure with impaired diffusion of gases, with impaired pulmonary perfusion, with disorders of the ventilation perfusion ratio. The main manifestations of respiratory failure is dyspnea, hypoxia, hypercapnia, cyanosis. This is due to significant reduction of hemoglobin in the blood. Respiratory failure, the inability of pulmonary apparatus to maintain normal gas composition of the blood. Hypoxemic, mixed, and hypercapnic. Ventilation failure develops as a result of impaired gas exchange between atmospheric air and lungs alveolar hypoventilation. Etiology: respiratory disorders. It's effects of the central nervous system, drugs, and barbiturates. Disorders of the spinal cords, motor neurons, tumors in the spinal cords, syringomelia, polio. Disorders of the neuromuscular system. It's a myositis, myasthenia, botulism, tetanus, malformations. Chest disorders, injury, deformities, ossification of cartilage, disorders of the integrity of the pleural cavity, pneumothorax, impaired airways, patency, bronchitis, bronchial asthma, tumors, disorders of the elastic properties of lung tissue, emphysema, a decrease in the number of functioning alveoli, it's a pneumonia, pulmonary edema, tuberculosis. Ventilation, respiratory failure. Some variant, it's a dysregulatory variant. This develops due to the dysfunction of the respiratory centers. Manifestations, bradypnea, tachypnea or polypnea, and hyperpnea. Kussmaul breathing. Kussmaul breathing, this is a noisy deep breathing. This is strong inhalation and active exhalation, which is provided by forces contraction to not only the expiratory muscles, but also of the muscles of the neck, faces, and other accessory muscle, for example, which usually do not participate in breathing. This is observed in diabetic and uremic insect. Periodic breathing. Periodic breathing, disorders of rhythm of breathing in which periods of breathing alternate with periods of apnea. The genesis, periodic respiration or periodic breathing is the normal concentration of carbon dioxide is not enough to stimulate of respiratory center, and respiratory rest occurs, but during apnea, partial carboxygen increase, the suppressed respiratory center responds to this increase, respiration is restored, this in turn leads a decrease in carboxygen pressure and a new period of apnea until carbon dioxide accumulated again in a large quantities. Chain stocks respiration or chain stock breathing is characterized by a gradual increase and gradual decrease in the amplitude of respiratory movements from hyperpnea or to apnea. It is observed in hypoxia of the brain, anemia in premature children, and due to action of morphine. Beyond respiration or beyond breathing, this is a form respiration in which the amplitude of respiration movements is stable, interrupted by periods of apnea. It's observed in meningitis, encephalitis, for example. Apnoea is temporary cessation of breathing. Is observed at decrease in reflex of chemical stimulation of the respiratory centers, for example. After the introduction of adrenaline on the background of hypoxia, intoxication, brain damage, or due to decrease in carboxygen in the arterial blood. And here, apnea, bradyapnea, tachypnea, beyond respiration, singing, and Kussmaul. Yes. Grox whale-like breathing or respiration or dissociated respiration is characterized by a wake-like change in the depths of respiration and differs from chain stocks respiration in the absence of period of apnea. Grok respiration is caused by the failure of the respiratory coordination center caused by chronic cerebrovascular disorders. It is more often observed of brain abscess, meningitis, brain tumor, for example. Terminal respiration, apnea respiration, and gasping breathing or agonal breathing or respiration. Three types, for example, terminal respiration is observed in terminal condition, varieties of pathological breathing, apneic and agonal breathing, apnea respiration manifestation by convulsive breathing, respiratory arrest at the height of respiration, periodic exhalation in the experiment obtained by cutting both vagus nerves and brain stem between pneumotaxis and apnea center. And gasping breathing or agonal, the appearance of single liquid convulsive respiratory movements after respiratory arrest as a result of paralysis of respiratory center. Shortness of breathing or dyspnoea, a subjective constitution of feeling of shortness of breath and the associated need to increase respiration. There are types of shortness of breath. It's inspiratory, hypoxia, or expiratory, and mixed Respiratory pneumothorax, cardiovascular disease, emotional and physical stress, the second stage of asphyxia, and expiratory, it's a bronchial asthma, emphysema. In addition, there are physiological, pathological, subjective, and objective shortness of breathing. Ventilation, respiratory failure, or types restrictive insufficiency associated with restriction of external respiration. And some causes, it's a pulmonary, increase the elastic resistance of the lungs and reduce the distension of the lungs. Pneumosclerosis, for example, surfactant deficiency, it's a respiratory distress and smoking, blood stasis in the lungs, pulmonary edema, and observed in pneumonia, pneumosclerosis, pneumofibrosis, and atelectasis. And some causes, it's a pulmonary for ventilation, respiratory failure, and extrapulmonary, it's a restriction of excursion of a thorax, violation of the integrity of the chest and pleural cavity, and observed in hemorrhidrothorax, pleuricity, pleural fibrosis, spinal deformities, and restricted diaphragmatic movements. And very important, the main criterion of restrictive respiratory failure is a reduction of elasticity. Next type, it's obstructive type. It's a ventilation respiratory failure. Insufficiency is connected with increase of resistance of airways. Causes: airway obstruction, spasm of bronchial smooth muscle, laryngeal muscle spasm, airway compression. And parenchymal insufficiency of external respiration. Parenchymal insufficiency and parenchymal respiratory failure with impaired gas diffusion. The structure of the membrane suffers from pneumosclerosis, fibrosis, pneumonia, alveolitis, sarcoidosis. Diffusion is disturbed is pneumonia, pulmonary edema. Next, it's a particularly severe form of diffusion insufficiency are observed is in respiratory distress syndrome. Respiratory distress syndrome, adhesion of the alveoli due to impaired synthesis of surfactant. In newborns, in premature births, in shock lungs, aspiration, pancreatitis. Result of alveolar capillary block is a decrease in the ability to the lungs to exchange gas and disrupt the gas composition of arterial blood. And very important, main criteria for diffusion insufficiency is a simple test for hyperventilation, which does not improve blood oxygenation. Parenchymal respiratory failure with impaired lungs perfusion. Impaired lungs perfusion is observed due to reduction of right ventricular pressure, increased pressure in the left atrium, and increased resistance in the vessels to the small circulation. It's thrombosis, embolism, narrowing for the pulmonary arterioles. And parenchymal respiratory failure with impaired ventilation perfusion ratio, it's observed when increase or decrease the ratio of the unit volume of alveolar ventilation on the minute volume. For example, normally this ratio is from 2 1.0. Atelectasis, it's a pathological process in which the ventilation of the alveoli stop due to their failing and resorption of air in them. This is observed in accumulation of exudate in the pleural cavity. Pneumothorax tumors, bronchial obstruction is surfactant deficiency substances which provides surface tension of the alveoli and does not allow them to stick together. It's, for example, collapsed lung. It's atelectasis, construction, atelectasis, resorption, and compression. Atelectasis. Pneumothorax is a pathological process characterized by increased pressure in the pleural cavity due to the accumulation of air in it. Escape of air into the pleural cavity is observed in penetration chest injuries, decay of lungs tissue, and rupture of emphysematous alveoli. Pneumothorax may present closed, open, and valve. Closed pleural cavity does not communicate with atmospheric air. Open connection of the pleural cavity with the atmospheric air of the pleura is constant valve. And valve, it may present some valve in pleura with change in position, open, close, open, close. Pneumosclerosis or fibrosis. It's a next pathological process in the lungs, which is characterized by excessive growth of connective tissue. Most often, pneumosclerosis occurs as a result chronic inflammatory process, toxic lesions, pneumoconiosis, silicosis, atelectasis, emphysema, keratinosis, etc. And age character important too. Pneumosclerosis caused significant disorders of external respiration, which is associated with reduction of the respiratory surface of the lungs, the growth of connective tissue, decrease in elasticity of lungs, and thickening of alveolar capillary membranes. Pneumonia is an acute inflammatory process in the lungs, mainly of an infection nature. Etiology, the main causes agents of pneumonia are bacterial, viruses, and fungi. And with clinical picture, it's a syndrome of general inflammatory changes, syndrome of inflammatory changes of lung tissue, syndrome of changes from other organs and systems, and intoxication syndrome. And for example, here I have the small airway, yes, and small airway with pneumonia. Germs, white blood cells, and mucus present in alveoli with big portion. Very hard and very popular in a different region too. It's a bronchial asthma. Is a chronic inflammatory disease of the respiratory tract characterized by bronchial hyperreactivity, which is caused by a significant number of cells and mediators of inflammation manifested by recurrent attack of wheezing and asthma. Etiology, it's axagenous and endogenous. Allergens play an important role in the development of asthma. In a pathogenesis, at the heart of pathogenesis asthma are mainly allergic reaction of types. First, the leading role of the development of bronchial asthma have immunoglobulin E, leading to the formation of immune allergic inflammation of the respiratory tract. As a result of the inflammatory processes, there is bronchial obstruction due to bronchospasm, edema of the bronchial mucus obstruction, and signs and symptoms: episodic shortness of breath with difficulty at exhalation, hot more at night and during exercise load, and episodic wheezing in the lungs. Asthma and airways, normal airway, it's the best position, yes. Asthmatic airway and asthmatic airway during attack, it's wall inflamed and thickened. And here, for example, obstructed airways, it's unfortunately very hard for breathing in this moment. Asphyxia as an acute respiratory failure in which oxygen causes to enter the bloodstream and no carbon dioxide is exhaled. There are 4 periods in the development of the syndrome. First period characterized by inspiratory dyspnea. Second period, shortness of breath becomes expiratory. Third period, it's a preterminal pause, and fourth, it's a terminal. During 3-8 minutes, it is characterized by recovery, heartbeat, and slight increase in blood pressure, gasping breathing. And death occurs from paralysis of lumbar respiratory center. Surfactant system and its disorders. The surfactant system of the lungs consists of type 2nd alveolar site and itself 3 layers that covers 4 alveoli. Surfactant plays an important role in providing protective mechanism in regulating the water balance between blood and alveoli. Oxygen transport through the air barriers has antibacterial, antioxidant function, and immunoregulatory properties. Surfactant main role of the surfactant is to reduce the surface tension in the alveoli while reducing pulmonary pressure at the time of exhalation. And here, for example, type first and second alveolar cells and type second alveolar cell with surfactant production and secretion in the alveoli. Adult respiratory distress syndrome is an acute respiratory failure that occurs in acute lungs injuries of various etiologies and is characterized by non-cardiogenic pulmonary edema, respiratory disorders, and hypoxia. Different causes: pneumonia, sepsis, shock, inhalation, and irritants and toxic substances, pulmonary artery embolism. Pathogenesis of adult respiratory distress syndrome under the influence of etiological factors in the pulmonary capillaries. Interstitial lungs tissue accumulates a large number of activated leukocyte and platelets. It is assumed that they emit large amount of biologically active substances, which damage the alveolar epithelium and vascular endothelium, change the role of bronchial muscles. Vascular reactivity stimulates fibrosis. To development of atelectasis also contributes secondary decrease in activity surfactant. Next, it's a syndrome Undini or primary central apnea. Is a rare disease characterized by defect in a TOX2B gene, which is responsible for the sensitivity of brain chemoreceptors to hypercapnia. Hypoxia are some causes, and hypoxia or other variant, it's oxygen starvation from the Latin hypo, little oxygenum. Oxygen is a typical pathological process that occurs due to insufficient oxygen supply to tissue or as a result of disruption of its used by cells in the process of biological oxidation. Classification of the hypoxia, it's according to etiology: hypoxic, respiratory, circulatory, blood, and tissue. According to the cause of development, it's lighting, acute, subacute, and chronic. Depending to the prevalence of the process, it's a general and local. And some types of hypoxia, it's a hypoxic or exogenous respiratory and pulmonary hypoxia, circulatory hypoxia, hemic blood hypoxia, tissue histotoxic hypoxia, and exogenous hypoxia or hypoxic variant occurs due to decrease in the partial pressure of oxygen in the air. There are monobaric and hyperbaric hypoxic anemia. Hypobaric is caused by general decrease in barometric pressure is observed. For example, when climbing mountains and staying in assault aircraft without individual oxygen system, mountain or high altitude disease, and normobaric hypoxia. It's developed at normal general barometric pressure, but the reduced partial pressure of oxygen in air. At stay in the closed room of small volume work in mines and well, respiratory type of hypoxia. Respiratory type have some etiology. First of all, it's alveolar hypoventilation. Next, decreased lungs perfusion. And next, it's a difficulty in diffusion of oxygen in the lung. Circulatory or cardiovascular type. Etiology, disorders of general hemodynamics, acute and chronic heart failure, shock and collapse. And disorders of local circulation. And changes in blood gas in circulatory hypoxia. It decreases oxygen pressure, arterial hypoxemia, increase in arteriovenous difference in oxygen by reducing its arterial blood. Next type, it's a hemic or blood type of hypoxia, disorders of the transport properties of blood. It's etiology factors, anemia, infusion of large volume in saline various blood substances, and qualitative changes in hemoglobin, the carbon monoxide poisoning, metahemoglobin poisoning, and congenital anomalies of hemoglobin, for example, thalassemia, sickle cell anemia. Change in blood gas in hemihypoxia. It's a normal partial pressure of oxygen in arterial blood, reduction of partial pressure of oxygen in venous blood, and reduction of arteriovenous difference in oxygen, and acidosis. Next type of hypoxia, it's a tissue hypoxia. Etiology, it's a violation of oxygen supply to tissue, and inhibition of biological oxidation. Separation of oxidation and phosphorylation process. It's a thyroxine and triiodthyronine medicinal substances, microbial toxins, and changing in a blood gas in tissue hypoxia, reduction of arteriovenous difference in oxygen, increase in venous blood portion of oxygen, and very important and very hard process, it's hypoxic load. This occurs when the activities of an organ or tissue is excessive, when the functional reserves of the transport and oxygen utilization system are insufficient to meet to need. This form of hypoxia is of practical importance when the skeletal muscles and myocardium are overloaded. And at excessive loading on heart, there are relative coronary insufficiency, local hypoxia of the heart, secondary circulatory hypoxia. And the main protective and adaptive reaction in hypoxia, it's a reaction aimed at increasing the delivery of oxygen to the blood, local or in a tissue, yes, reaction aimed at improving the supply of oxygen to cells, and reaction or in oxygen utilization system. Protective and compensatory reaction aimed at increasing oxygen delivery to tissue include reaction of external respiration, reaction of the circulatory system, reaction of the blood system. To the local or tissue reaction at improving the supply of oxygen to cell in hypoxia include increased local blood flow, increasing the number of functioning capillaries, and increased content of myoglobin in cells, which in muscle is an intercellular oxygen depot. Next, the main metabolic disorders in hypoxia. Hypoxic cell damage is determined by the following mechanism. At the heart of all disorders of hypoxia is the reduced formation of macroorganic phosphorus compounds, which limits the ability of cells to perform normal function and maintain intercellular homeostasis. Next, it's in hypoxia, activation of anaerobic glycolysis occur due to the impossibility of aerobic. And with a significant lack of oxygen, the components of the respiratory change are in a restored state. This leads to the activation of free radical oxidation reaction. The result is the activation of lipid peroxidation and the inclusion of lipid treat of the cell damage. Disorders protein metabolism are violation of process of elimination of nitrogenous product in the body, stress, fatty acids, and state of acetonемia. It's two very important in this variant. As a result of those metabolism disorders, the contractile, secretory, and sensory function of cells are disturbed. Acute cells hypoxia is characterized by the following periods. It's a latent period, period of dysfunction, recovery period, and period of irreversible cell damage. And cyanosis, for example, is a bluish color of mucous membranes and skin in hypoxia due to the presence in the capillaries of the skin and mucous membranes of more than 5% of anoxidized or reduced hemoglobin. Cyanosis is most pronounced in hemodynamic congestive type of hypoxia, less in a state of ischemic hypoxia, and hypoxias of anemic and histotoxic type. Cyanosis is not found. And replay about surfactant. Surfactant is secreted in a specialized type 2 alveolocytes. Translated from English, surfactant, mixture as surface active substances located at the air liquid interface in the lung alveoli. Very important moment. Surfactant have some function. It's a reduction of the surface tension of the film of tissue fluid covering of the alveolar epithelium. Bactericidal immunomodulatory stimulation of activity of alveolar macrophages for the formation of an anti-edema barriers that prevents the penetration of liquid into the lumen of the alveoli from interstitium. Exosurf pediatric pharmacological with pharmacological action. It's a special liquid with indication for taking surf, and here, for example, in a schematic surfactant in the alveoli, small portion, some special liquid for connection, and some variant synthetic, for example, surfactant for normal breathing newborns child. Respiratory distress syndrome, one of serious problem that doctors have to face when the delivering premature babies. First of all, it is a disease of newborn manifested by development of respiratory failure immediately of within a few hours after birth. The disease gradually warms, and usually by 2 or 4 days of life, its outcome is determined gradual recovery of the death of the baby. And active and passive part in a consistent this unical complex and very important for breathing this surfactant. Next, we have pertinent information about Quincke edema or angioedema. Is an acute allergic reaction of the body characterized by massive swelling of the mucous membrane, skin, and subcutaneous fat, which is caused by the body reaction to various factors of biological or chemical origin. The decrease is named after the German doctors Heinrich Quincke, who first described it in 1882. It's a German therapist and surgeon, author of large number of discoveries and innovation in the field of medicine, and some variant disorders very hard. And other variant, it's tuberculosis, yes, cavernous tuberculosis in the lungs, for example, tuberculosis or TB, shot of tuberculosis bacterium, formerly tuberculosis, and is a widespread and in many causes fatal infection diseases, and main reason is Mycobacterium tuberculosis. Under the influence of endogenous and exogenous teratogenic factors in the process of intrauterine development, deviation in the formation and development of all organs, systems, and parts of the human body are possible, often occur. They are also found in the respiratory system. Exogenous teratogen factors, it's a physical, chemical, and biological. Endogenous factors, it's heredity, chromosomal abnormalities, endocrine diseases, biological inferiority of GM cells, and which includes pregnancy and the end of the Klein-Bernstein period of mother and father in old age. Classification of development disorders of the respiratory system. First of all, abnormality causes by combined disorders of the development of several structures, agenesis of the lungs or lobes, aplasia of the lungs or lobe, hypoplasia of the lungs or lobes, simple and cystic variant, and additional lung lobes. Some defects of development of respiratory organ. It's a defects of development of the thorax, of the larynx, and some variant with changing forms of the larynx, aplasia, cysts, and other. And defects of development of trachea and bronchi, it's agenesis, tracheal atresia, stenosis of trachea and bronchi is congenital, and tracheobronchomegaly or syndrome Unye-Kun. Tracheobronchomalacia, William Campbell syndrome, and bronchomalacia. Bronchial or ectatic emphysema, tracheal bronchus, the vertical of trachea and bronchi, and defectus of lungs development. It's apnea, agenesis of lungs, aplasia of lungs, agenesis of lungs of the lobe of the lungs, hypoxia of the lungs, additional lungs, additional bronchi, pulmonary sequestrum, congenital pulmonary emphysema, bronchopulmonary, mirror lung, part of the unpaired vein in the lung, and anomalies caused by predominant violation of the development of bronchoepithelial branching. It's trachea bronchomegaly, stenosis, lobar emphysema, trachea and bronchial diverticle, bronchogenic cyst, hamartochondrome. And anomalies of the development of the small circular vessels. It's a vascular aplasia, hypoplasia of vessels, aneurysm and arteriovenous fistulas, and anomalies of pulmonary vein. Very important in disorders of the breathing, it's anomalies of the vessels of the great circulation. Pulmonary sequestration, anomalies of bronchial vessels, and part of an unpaired vein, anomalies of the tissue and organs, other tissue and organs. It's a detmoid cyst, teratomas, cyst fibrosis. And on the listed form of malformations, the most common abnormalities are due to impaired development of the bronchial epithelial branching, polycystic disease, ectasis, bronchopulmonary cysts, for example, and some variant anomalies of development of larynx in children. Stenosis of the larynx is a nerve of its lumen, which leads to difficulty in passes air air during breathing. Hypoplasia of larynx pathology characterized by underdevelopment of the cartilaginous structure of the larynx, which forms the framework of the larynx, and diaphragms of the larynx, laryngocognital cyst, anomalies of development of trachea and bronchi, congenital stenosis of trachea, and bronchus, bronchogenic cyst, and diverticulum, Munier-Kuhn syndrome. It's a defect characterized by sharp expansion of the bronchi and trachea. There is underdevelopment of elastic tissue and muscle fibers. The disease is hereditary. Tracheobronchomegalia, special disorders, excessive expansion of the trachea and main bronchi. Tracheobronchomalacy. Here you can see a normal and inspiration and expiration in the tracheomalacia. Campbell-Williams syndrome, anomaly of lungs development. It's agenesis of lungs, hypoxia, lungs cysts. And pulmonary sequestration, apnea, absent one lungs in one part in the chest, for example, and mirror lungs syndrome, Cartaginer, and other. And here, for example, congenital lung malformation, pulmonary hypoplasia, sequestration, congenital cyst, adenomatoid malformation, or abbreviation CCA, congenital lobar emphysema, and lung agenesis. And characteristics syndrome Cartaginer with a special schematic too. mucoviscidosis or cystic fibrosis. It's a special form. Idiopathic fibrosis alveolitis. And you remember, don't kill yourself and us too. Thank you for your attention, dear